For information, I mean, when we did an assessment, we probably could have taken 30 or 40% of the patients, if you look at the criticality of it. On the way north, the UN convoy was inspected at the Wadi Gaza checkpoint, and ambulance and crew members had to leave the vehicles for identification, exposing them to risk. Two of the PRCS staff were detained for over an hour, and we had to wait there, further delaying the missions. And we witnessed that one of the staff was being made to kneel at gunpoint and taken out of sight. Finally, he returned, and we could move on as well. Because, for example, we had plans to stay at least 2 hours, 2.5, 3 hours at the hospitals. That was our plan. We only had 15 minutes left because we had needed to get back to the military checkpoint by 4 p.m. That was because of all the delays, and including, of course, the delays because first on the detention going in, the temporary detention going in, and definitely the detention going out, which took a long time. I'll tell you, going out more than 2.5 hours, that process. And when we interviewed the PRCS person the next day, so he informed us that he was harassed, beaten, threatened, and even stripped of his uniform, blindfolded, hands tied behind his back, and treated in a degrading and a humiliating manner. And once released, he had to walk towards the south with his hands still tied. I want to remind everyone that 3 weeks after that was on the mission where WHO also led mission, where we brought supplies in to Shifa and helped to refer and bring patients to a more safer place down south. That was on 18 November. And the whereabouts of 4 people, and were 3 of the Ministry of Health and 1 PRCS staff, which were detained on that trip, they're still unknown.